Type 2 diabetes. I'm going to talk to you about curing this disease, but let's first talk about how you get type 2 diabetes. With type 2 diabetes, you have plenty of insulin. You have plenty of insulin. You have plenty of blood sugar in your system. It's just that your transport mechanism has shut down. You've developed insulin resistance, so that even though the insulin is there to open up the active transports, your transport system has become inactive. It's called insulin resistance. You've heard about that. It's a normal condition. It's not a disease. It's what the body's supposed to do. And I'll explain to you why the body is supposed to do this. So that's type 2 diabetes. Under normal circumstances, the body gains a certain amount of fat, particularly in the fall, the winter, or in the late summer and the fall, getting ready for winter. You could gain maybe 20, 30 pounds, maybe 50 pounds. And that's enough to make you through the winter, but you don't want to gain any more. I mean, that 20, 30, 40, 50 pounds of extra body fat, that's intended for better survival. That's to keep you alive longer and through the winter. But what if you were to gain more weight? What if you were to gain 100 pounds or 300 pounds or 500 pounds? Then you couldn't get away from the saber-toothed tiger. You couldn't get away. You couldn't get into the cave entrance. In other words, it would be a terrible survival disadvantage to gain more than what you need to get through the winter. So what happens is the body shuts down its ability to store fat. Insulin drives fat into fat cells. You develop insulin resistance naturally, normally, and correctly. This is not a disease. It's the body's metabolic adaptation for survival, so that you don't end up to weigh 3, 4, 5, 6, 800 pounds. I have taken care of several patients in my career that did not develop insulin resistance, and they've gained 3, 4, 500 pounds. These are relatively healthy people. Sure, they have damage to their lower extremities, but they don't have heart disease. They don't have high blood pressure. They don't have high cholesterol. They're healthy except for the added weight. What happens in these individuals, unfortunately, there are just a few of them, is they do not develop insulin resistance as a normal, healthy person would. So how do I treat a type 2 diabetic? With a type 2 diabetic, what I do is I stop all their medications. Yes, I do, from day one. I'll find myself in a situation where commonly I'll stop 30, 40 units of insulin a day. But I have been in situations where I've stopped as much as 120 or 140 units of insulin a day on a type 2 diabetic. But, I have a lot of experience doing that, so I can pretty much guess who's going to do well, who is truly a diabetic that does not require insulin. They're non-insulin dependent diabetics or type 2 diabetics. So I stop all their medication day one, and I treat them with food. Now there's an intermediary type of situation. It's called type 1.5 diabetes. With type 1, you have insufficient insulin. With type 2, you have plenty of insulin production. It's just your transport mechanism's been shut down due to insulin resistance. Type 1.5 diabetes is this condition. Plenty of sugar. You have plenty of insulin, but some of your active transport has been shut down. And I see this commonly. Now, this is a situation, type 1.5 diabetes, where you're not so diabetic that you end up in the hospital with ketoacidosis, but you still find yourself having an elevated blood sugar. You may find yourself losing too much weight, suffering from frequent urination and excessive thirst. So how do I treat a type 1.5 diabetic? Well, some of them are going to require medication. What I do is I put them on medication and I use insulin only. I don't use any of the diabetic pills because they're dangerous. They may need insulin. I try and give them a long-acting insulin. I give them just enough to cover up their symptoms, and their symptoms may be too much weight loss. So I stop the weight loss. It may be excessive urination or excessive thirst. And those symptoms are also stopped when you give a little bit of insulin. And you can end up just giving them a small injection once in the evening of a long-acting insulin to cover these particular symptoms. But again, this is a type 1.5 diabetic who has a partial problem. They're not fully type 1 diabetic, and they're not fully type 2 diabetic. They developed some insulin resistance, but not complete insulin resistance. And again, you want to be careful about giving insulin, and even in this condition, because you don't want to develop hypoglycemia for the reasons I told you. It's a dangerous condition. So it's better to err on the side of too little insulin rather than too much. I'll talk to you about why I don't provide the pills in people for type 1 or type 2 diabetes. Let's talk about the medications on how you treat a diabetic. This is type 2 diabetics. The first line therapy, and pretty much all doctors teach this and treat their patients this way, is they start them off on metformin, also known as glucophage. And the sales pitch is it doesn't cause weight gain, and it may benefit the arteries. In other words, it's the medication that does the least amount of harm of all the oral medications, glucophage. 58 million Medicare patients, over half of them were on glucophage as their first-line therapy. The idea that glucophage will decrease your risk of artery disease, heart disease, and blindness, et cetera, is in much contention. A review of the studies showed that 31% show an increased risk of all-cause mortality and 64% increase in cardiovascular mortality when they take metformin or glucophage. In other words, it really hasn't been determined whether or not glucophage really can use the bragging rights of saying that it decreases the risk of vascular disease. And doctors who are doing it based on their best guess or a fairy tale. The second line therapy, and the next medication I find people taking, is sulfonylureas. This is a medication that was developed just about the time I started in medicine, back in the 1950s. I started in medicine in the 1960s. Sulfonylureas were first used as herbicides, but they noticed that they decreased the blood sugar level by increasing the production of insulin by the pancreas. This represents, these kinds of medications, 30% of the sales of diabetic medications. And they go under various names. Back even in the 1970s, when I was a young doctor, the warnings appeared in the physician's desk reference about using these kinds of medications. This is a snapshot out of the physician's desk reference. It's titled Warnings, Special Warning on Increased Risk of Cardiovascular Mortality. And what they say is you increase your risk of dying of heart disease by 2.5 times compared to similar diabetics who don't take any medication at all. 2.5 times the risk of dying of heart disease. Why would you give a pill to a patient that increases the risk of dying of heart disease? Yeah, it lowers their blood sugar, but they end up dead earlier. Now, intensive therapy of diabetics has always been the goal of doctors. And pharmaceutical companies have done the best they can to provide the medications to lower the blood sugar. So there have been 6 major studies comparing aggressive treatment where you make the blood sugar closer to normal, say 100 milligrams per deciliter, and the hemoglobin A1C closer to normal, which is 6%. There have been 6 and only 6 major studies that have looked at this. Now, I'm going to go through these studies quickly with you, and you could stop the slide presentation as you're watching it through your video download. And you can look up the studies and you can see whether or not I'm telling you the truth or I'm exaggerating what's going on. I have no doubt that you're going to read the studies the same way I do. The first study, the Diabetic Control and Complications Study, their conclusion was it may increase your risk of coronary artery disease. The second study done was the Veterans Affairs study. There were 2 veteran studies done. They found a strong tendency toward worsening cardiovascular outcomes in patients with intensive control. The third study done was the TRACE study, which was done in Europe. It's the largest study done on treating aggressively type 2 diabetics. And they showed an increased mortality from heart attacks in patients who were intensively treated. The difference being they compared a group of patients who had regular care, say their hemoglobin A1Cs were in the 7% to 8% range, compared to patients in the intervention group who were given as many as 4 pills a day, checked their blood sugars as much as 4 times a day, gave themselves multiple insulin shots to cause their hemoglobin A1C to reduce down to close to 6%. And they accomplished that. They reduced their hemoglobin A1Cs down to close to 6%. But the outcome that you care about, which is staying alive, didn't turn out. There are the following 3 studies that were published in the New England Journal of Medicine in the year 2008. The first study was the ACCORD study. The Heart, Lung, and Blood Institute stopped the ACCORD study 17 months early because of an increased risk of dying in the treated group. The ADVANCE study, no significant benefits from type 2 diabetes, but they had much more hypoglycemia. And then there was the VETERANS study. They showed a weight gain of 18 pounds compared to the control group, which gained 9 pounds. And they showed 3 times the risk of sudden death. There are the 6 studies that show you that aggressive treatment of diabetes kills. Well, it's not surprising because an approval of a diabetic drug depends upon whether or not it lowers blood sugar, not whether or not it kills you. Can't kill you immediately, but in the long term, it can kill you. As long as it lowers the blood sugar level, it is approved by the FDA, and it can be used. Now, before 2008, and before the studies came out that I just showed you, that was all that was required, is that the medications lowered the blood sugar. But after these reports, the industry, pharmaceutical industry, as well as the FDA, decided that we ought to include other criterion for the treatment of diabetes. We ought to show that it reduces the risk of dying of heart disease. So the modern diabetic medications, they do just that. They show you that they can reduce risk factors for diabetes and heart disease. And they've developed a whole bunch of medications. And these are what are being advertised to you on your cable news network these days. But they hardly reduce your risk of complications from diabetes, cardiovascular complications. They reduce the risk only 1.3 to 2.2%. And that's looking at the risk factors. That's not looking at whether or not you die of the disease, but whether or not you lowered your cholesterol. But they're associated with all kinds of serious adverse effects, like genital infections, leg and foot amputations, eye damage, gastrointestinal problems, hypoglycemia, thyroid cancer. Certainly not the way I treat my patients.